The only thing more distressing than failing an IVF cycle is not knowing why the IVF cycle failed. And while it's true that we don't always have answers, what's really terrible is that IVF doctors will hide information from patients and not share the truth with them. And this obviously causes a lot of angst and grief, and patients feel powerless and cheated, and they feel locked in because the doctor refuses to share information. And a lot of clinics are very sneaky about what they do. They make the patient sign up for 3 IVF cycles in advance, and because the patient is locked in, the patient dare not ask any questions because they don't want to upset the doctor or try to be seen as being a difficult patient. So they keep quiet and they swallow whatever the doctor tells them, even though in their heart of hearts they're getting burnt up and they know they're being cheated. But because they're trapped, there's very little which they can do. And these are typically clinics which do not share any information with the patient. They give them pieces of paper called discharge summary, but no details. And specifically, there is not a single photograph of the embryo which the doctor has transferred. So the poor patient is completely dependent on what the doctor is saying, and typically these doctors don't say the truth. What's even worse is they often sing a completely different story when the cycle has failed. So here's an example. At the time of the transfer, they say, "Oh, your embryos are brilliant, grade A, of course you're going to get pregnant, congratulations." And then when the cycle fails, they look at the same record and says, "Oh, your embryos weren't very good. You know what? Next time we'll use more expensive injections for which you'll have to pay a little bit more, but I'm sure we'll get better quality embryos if we do that." Poor patients stop. So, okay, whatever, I need to get pregnant. So the patient falls into that trap, gets suckered, pays an arm and a leg more without realizing this in advance. And then when that cycle fails too, the doctor says, "You know what? I think the problem is with your eggs. Maybe we should be using donor eggs." It's so easy to take poor IVF patients for a ride. And when I say poor, I don't mean financially poor. I mean emotionally poor, because they're so vulnerable and there's so many unethical doctors willing to take advantage of that. And that's why it's so important that patients need to be proactive. You just can't afford to leave everything up to the doctor. You find a good doctor, you're fine. Suppose you end up with a bad doctor. Not only will you end up wasting a lot of money, you'll just completely ruin your chance of having a baby. And then because you've wasted so much money, you'll refuse to try treatment at any other clinic. And that's why you must insist that the doctor give you photos routinely of all the embryos they transfer. Every good clinic does it. And in fact, if the clinic refuses to do it, this is actually a red flag, which means something is seriously wrong. And obviously the clinic has something to hide, which is why they're not sharing information up front with you. Good clinics are proud of the treatment they offer. They're proud of the embryo quality. And that's why they give photos, not just for the patient's sake, but because they know that that patient will get a second opinion. And if they have produced A quality, top class embryos and documented this photographs, any doctor will say, yes, your treatment quality was good, but sometimes IVF cycles fail and we don't know the reason why. So if the IVF cycle failed, even though top quality embryos were transferred, then the fact of the matter is human reproduction is not efficient. But if the IVF cycle failed because the doctor did not provide you with adequate documentation, because it's a poor quality IVF clinic, then you need to do a better job and find a better IVF clinic. And if you're looking for one, please reach out to me. I'm Dr. Malpani at Malpani Infertility Clinic. Our website is www.drmalpani.com. We've got more than 1,000 pages of information, and I'm always happy to offer you a free second opinion. It's my personal email address, and all the information you provide is confidential. And we're happy to look forward to helping you to have a baby so that IVF doctors don't cheat you and don't take advantage of your vulnerability, and you get the best possible care so you can maximize your chances of having a healthy IVF baby.